So we're going to unbox the SCi kit. This SCi kit comes with 5 preformed SCIs. In there, you're going to have 5 boxes, 5 SCIs, and your thermoplastic beads. This is the important information that you're going to share with your patient, and it's also the consent form. So this is the post-op form that you're going to give them. You also have the leaflets that you can give to other patients, or you can give to your patient to give to people that they know and are going to recommend you to. The boxes for the SCI to stay in during the day come empty, and we have 5 preformed reduced vertical SCIs like this, and a bag of thermoplastic beads. Remember, you only need about a teaspoonful. So that's the kit. Let me show you what you need in order to use the kit, and that is basically tweezers, a scalpel if you need to just trim interdental thermoplastic beads, some form of lubrication to smooth the gel. We use this KY, and then we have boiling hot water and cold water, and that is basically the kit that you need, apart from yourself, your gloves, and a patient. Okay, so I'm going to make you an SCI, okay? Part of the training, when you come on the full day, we're going to share with you how you choose where you place it. Is it upper, is it lower? We'll talk about midlines and things like that. Today, I just want to show you how we actually make it. For these purposes, Phil, rest your head back for me if you would. When I look at Phil's teeth, I see that there's a lot of crowding and imbrication in the lower incisors. If I was to place the SCI on the upper teeth, there is a significant chance that the lower right 2 on Phil is going to take all of the pressure, and I don't want that. Arguably, I would consider doing a slide of a Phil against his SCI. But for now, to protect the lowers, I'm actually going to make the SCI on his lower teeth. So, thermoplastic beads. You need about a teaspoonful of the thermoplastic beads. They go into the hot water. And I'm going to stir those up. They're going to go clear, they're going to become more gel-like, and they're going to bond and stick to each other. You can see that's already beginning to happen. I want it completely clear. Now, whilst I leave that in there, I'm going to use just a blob of the jelly on my glove. And there we go, I'm happy with that now. So I've got, as you can see, clear gel. I'm going to pop that into the preformed SCI. Next question is, how much do you use? You don't want to overfill it. It's kind of full, but I'm going to pinch away the excess. So I squeeze, and then I'm snapping that away. I'll pop that back in case I need it. So now I can show you that my SCI is full. And now I'm going to place it in the midline of his lower incisors, and I'm going to gently press that home. Then I use my jelly to begin to smooth the jelly around. I want to keep it as limited as possible. In other words, I don't want to spread it all the way across his teeth. I'm keeping it to within the area that the SCI is sat. If you've got somebody with really short, very worn teeth, then you can spread the thermoplastic gel out to encompass more teeth, because then you may increase retention. But with Phil's crowding, this will retain very nicely just as it is. Okay, so that is nicely seated. I'm happy. At this stage now, because I'm chairside, I'm going to use my 3-in-1 to begin to cool it down. So Phil, I'm just going to use some water. Bear with me. Gently take this out, pop it back in a little again, and I'm going to carefully take it out by holding just the shell, the main plastic. Pop that into cold water. That will take I don't know, 20 seconds to cool down. I know that it's cool because when I look at it, it will be white. If it's still an element of clear, I'm going to leave it in. So I'm going to give that another few seconds in the cold water. And there we have it. So I'm going to reinsert this now. I'm going to gently see that it fits nicely, which it does. So to me, that is a really good fit. What I want to find out now is, can Phil easily flick it out with his tongue, or is it an effort? It's an effort. Okay, so that's great. I'm happy with that. So bite together for me, Phil, now. Slide side to side. Beautiful, front to back. And relax. So Phil, rest your head back for me. Bite together, please. What I want to be checking now is that there's no contact of your back teeth whatsoever. And I also, ideally, I don't want the SCi touching your canines. So would you push forward and back for me? Slide forwards, slide back. Good. There's nothing meeting at the back. You don't feel anything meeting either, right? And now go side to side. Oh, beautiful. And again. And perfect. Okay, I'm very happy. Bite on your back teeth again. That's it. Open wide. So there's no contact in the back teeth whatsoever. We've got posterior disclusion in all excursive movements. We're in the midline. I'm happy with the angle. And we're not touching canines. Happy.